So back in the day, for some of the docs who were practicing in the 80s, they used to intubate nasally. And that's almost gone now. You're not going to do that as a paramedic in the front lines anymore. You may have the nasal trumpets you put in for maybe that intoxicated, snoring patient, you know. So you get that in there, and it'll help kind of clear that tongue out of the way. The oral airway you can't put in unless they're missing a gag reflex. They're going to gag it back out. And that's a huge adjunct before you bag somebody. So I think nasal intubation is pretty much gone. And oral intubation is an art that sometimes you have to paralyze someone, make them unconscious to do it, which you may not be doing as a paramedic. So I think as a paramedic, if you're unconscious, no gag reflex, you have to know how to put in that oral airway and bag them. But now if there's a struggling CHF, COPD, you're probably not going to paralyze them and intubate them. We have things like CPAP and BiPAP, which is great that you guys can start in the field. There's research data, good data, that you can prevent intubation by starting that on the field. And what you're doing in the field is preventing someone becoming ventilated and sometimes never waking up from it. When you intubate a COPD patient, sometimes that's their last goodbye. They don't have the strength to become extubated again. So remember, good bagging, CPAP, BiPAP.